Zoloft is a medication used to treat mental disorders, and one of the commonest questions about this medication is, what are the side effects? Hello everyone, this is Dr. A, quadruple board certified psychiatrist, addiction specialist, and lifestyle medicine physician. All medications have side effects, so does Zoloft. It is important to note though that because a medication can present with side effects does not mean that you will develop these side effects. We are all different and as such respond to medications differently. It is certainly important though to at least have an idea of what the side effects of Zoloft are in case you develop one of them. Before we go on to talk about side effects, let's talk a little bit about Zoloft as a medication. Zoloft is an antidepressant which belongs to the class of medications known as the SSRIs, selective serotonin reuptake inhibitors. The chemical name of Zoloft is sertraline, so you will have some people refer to this medication as Zoloft and others as sertraline. It's the same medication, and it works by increasing the availability of a chemical in your brain known as serotonin. Zoloft comes in liquid form and tablets. The tablets come in 25 mg, 50 mg, and 100 mg doses. Zoloft has a long half-life, and what this means is that it can be given once a day, usually in the mornings. Zoloft is used to treat mental health disorders like depression, anxiety, panic disorder, PTSD, post-traumatic stress disorder, OCD, obsessive compulsive disorder, and pmdd, premenstrual dysphoric disorder. Like most medications, Zoloft has many possible side effects, so I'll talk about 5 of the more common side effects. Let's start with gastrointestinal or GI side effects. This simply means side effects related to your stomach. Such side effects include nausea, vomiting, diarrhea, constipation, and stomach aches. These tends to be one of the commonest group of side effects with this medication and usually present within the first few days of using Zoloft. In a lot of cases, it tends to ease off within 5 to 7 days on average, so I usually tell my patients to keep taking the medication unless the side effects are very severe. On to number 2 side effects, sexual side effects. Zoloft can cause a decrease in sex drive, also known as a loss of libido. This can occur in males as well as females. Zoloft can also cause a difficulty in having an orgasm, which is known as anorgasmia. Again, this can occur in males and females. In men, there might be difficulty with an erection, known as erectile dysfunction. When it comes to treating sexual side effects of Zoloft, I usually would consider first of all decreasing the dose of the medication, and in some cases, switching the medication out completely. In some cases, however, we may use what we call an adjunct, which is simply another medication added to the Zoloft to help with the sexual side effects. The third side effect of Zoloft is fatigue. In most cases, Zoloft is given in the morning. This can, however, make some people feel tired. When this happens, one of the recommendations is to simply switch from taking Zoloft in the morning to taking it at night. In some cases, we may need to switch out the medication completely. The fourth side effect is paradoxical anxiety. Even though Zoloft is used to treat anxiety, it can sometimes cause some people to feel wired and as such more anxious. This feeling, however, tends to ease off within a few days to a week or so. But if it continues to be a problem, switching to another medication may be an option. Let's talk about number 5, black box warning. Even though this is not a very common side effect, I think it is important to talk about this. Like most antidepressants, Zoloft has what we call a black box warning. In October of 2004, the Federal Drug Administration (FDA) issued a black box label warning indicating that the use of certain antidepressants to treat major depressive disorder in adolescents may increase the risk of suicidal ideations and behaviors. There were 9 antidepressants labeled with this, and Zoloft was one of them. So these are some of the side effects of Zoloft. There are several others, and it is important to talk with your healthcare provider if you have any reactions or side effects with Zoloft. For more information on mental health, subscribe to this channel, and I'll talk with you soon.